we are going to do for you orbital reconstruction if you want after planning, right, for your eye. And we said we will do the PSI, that is for the post-traumatic deformity. Right? That's what we've suggested for you. So what we have to first do for this is we have to start with a CT scan. I think last time we did a scan here, but we didn't do the scan outside for your planning. That's only if you're ready for surgery. Then we will get the implant done and then we can proceed for surgery.
Get the surgery done in August.
August, then don't do anything now. We still have time. Or we can start the process.
You can start the process, but before that, I just need certain clarity on certain things.
Yeah, you can ask me.
So, where will the incision be done, sir? Here?
So we will probably use a scar on the upper and also around the lower or also inside the eye.
Because I don't want any more.
Nothing will be visible.
So from inside it can be done. Right?
Subconjunctival.
Instead of outside, because
yes.
Already there are here marks you can use.
Those marks on this aspect I might use, and here I will use either very close to the eyelid or eyelid and inside the eyelid.
Okay, inside.
But the scar won't be visible, 100%.
It would be better if you go inside.
Yeah, but see, the thing is, we have to now still plan the approach of the surgery will come after we plan the processes and the surgical plan.
Okay.
So it might be that that's the best approach.
Okay.
Approach is just the route to reach the site. So there are different approaches for. So there are different approaches that you need to use for the surgery. There is nothing like transconjunctival, which you're suggesting is better than a blepharoplasty. There's nothing like that. Depending on the procedure, we choose the best. I do both. So it's not like we can't do this one, transconjunctival. And if you see, blepharoplasty incision is an approach we're doing for cosmetic patients. And they don't get scar. So you're not going to get a scar anyways. That's not a big thing. We can.
And for the chipping of this right side, there is a bulge here. It's normal stuff. So for that, where will you?
Inside the mouth.
Inside here.
Inside the mouth, yeah, right side.
Right side. And there are also the old screws here that they have put.
That I have not planned to remove from the last time. If you want me to, because we have to consider that.
Because
for all those things, I have to take scans. Then you take a scan today, I will tell you more.
Because while doing the operation, you can just remove.
I could, but I need to see where they're placed, and I cannot commit without seeing.
Okay.
Last time we didn't see the scans. I only explained based on what I'm seeing in your reports.
Okay.
So if you want me to comment or say about those things, I need to take your scans.
And I think you know about my case about the double vision. And you also pitching the ophthalmologist while doing the operation, because it's not just about this thing.
Not ophthalmologist, so we'll have an oculoplastic surgeon.
Okay.
So that's an ophthalmologist who's done the training in the eye surgery of the eye. Like for example, these kind of reconstructive surgeries. So what we do generally is, so first we'll take the scan, then we'll do the planning, because we have the software and we have the manpower expertise for planning. So we'll do that. Then depending on the case, sometimes we call in on oculoplastic to be with us if it's involving especially diplopia or dacrocystorhinostomy, which is like the epiphora or the tearing, such cases. So that's the normal protocol anyway. So we will do that most in your case.
Because I don't have any vision problem, only the double vision.
Correct. That is a vision problem.
Just the
double vision is a vision problem. It's not that you don't have a vision problem.
Because I don't want the normal vision.
That will not go.
That won't be a problem. So
how will it go?
So that's
no way. How can we do a surgery risking your normal vision? Nothing will happen to your normal vision. Problem. No way.
And here the eyelid, it's been trapped.
I know.
As I discussed.
That we can release. That is why also sometimes to release that trap, blepharoplasty might be better. I have to see the scans.
Okay.
Because it depends on where the thing is there, what all has been done, where's the bone missing. A lot of factors are there. There's a nerve that comes out of here, the infraorbital nerve. So we want to make sure that nerve is intact. But sometimes when you approach and put the processes, we need enough approach for the processes. And in your case, you've got a lid lag and the shape of the orbit is not exactly symmetrical, it's lifted more. So We may have to derotate. All those things, yeah.
Here the eyeball is outside of this bone, but here it's inside.
So all those subtle things we will have to work on the planning, and then depending on what was done before and then what we're planning, we first arrive at the patient specific thing. Then we will ideally work which is the best approach. But you won't have a scar, that's for sure. The only thing I may not be able to guarantee is your double vision. It will not get worse, but it might persist. I will try to fix that also. That's what I'm saying. But in terms of your aesthetics, again, if it's not 100%, it might be 95%. There's going to be improvement. That's a surety. Because we're going to plan and it'll take a while before we arrive at what exactly we're going to do. So that's sure.
Because the symmetry is very clear.
Cheeky symmetry is surely sorted out. That's got to do in a different way. That's 100%. The scarring, we can't improve much. We'll improve a little bit. 20% like that, minimal improvement. Shape of the eye also, some improvement will be there. So overall, there'll be good improvement. And the only thing that may not happen is that double vision might not settle, because I still haven't seen the scans to know where the muscle incarceration is and what is happening inside. So it's just the
eyes
consultation.
will be aligned properly. Right?
Yes, it should be
because
aligned.
it's too, I think.
Yes.
And how long will it take for the recovery, sir, after the operation surgery?
So you might have to be with us for 5 days and then totally about 20 days.
20 days.
20 days is good enough, maybe even a little lesser. So what I recommend is, because you're also telling me about some plates which you want me to remove, I need to do 2 scans for you, one here and one outside. The one outside I will need for the importing. The one here is going to be going here. This is for planning, evaluation, diagnostics. The one you're going to take the other scan, it's for the printing, planning the execution of the procedure, and for printing the processes, peak or whatever. Okay?
One more thing, sir. If you don't mind, I would like to request, I don't want to record and put on.
We can do everything else ready first. Whether it's going to be 17th or 20th or 15th, I cannot tell now, because I think I'm not here on those days.
Okay.
I think in the US or Europe somewhere, I'm not there as far as I know. So then we can't do. And plus we have to plan. And you know what happens? Planning takes, let's say, 2 to 3 days. Then the printing, other things also takes 2 to 3 days, or 1 to 2 days maybe. You can do it hurriedly in 2 hours, but we have time now when you're in the same city, so it's easy.
And when can I get the date confirmation? If it's possible, please do the needful.
No, you have to ask them about the date. I'll ask them about you ask them about the date first only.
Okay.
But I think I need to see the scans also before we see that date, because see, I have to ascertain what all. They've given you an idea, but like I'm thinking I might need 3 to 4 hours, but I still have to be specific now. We're not seeing the current scans. Let's take these 2 scans.
Okay.
Then I will put on the software, we will put everything. Then I'll tell you. I think they will call you, or we can tell you today itself. And I don't think 17th is open of August, as I know. But you can just confirm that also with them. 2 things you can do simultaneously. Okay? CBCT and the CT scan எடுத்துட்டு print பண்றதுக்கு. சரியா?